dementia. What is dementia? Dementia is progressive loss of cognitive function, marked by memory problems and confused thinking. The most common form of dementia is Alzheimer's disease, a fatal condition that affects more than 5 million Americans. Types of dementia. 1. Chronic traumatic encephalopathy, CTE. 2. Creutzfeldt-Jakob Disease. 3. Dementia with Lewy Bodies. 4. Down syndrome. 5. Frontotemporal Dementia. 6. Huntington's disease. 7. Mild cognitive impairment. 8. Mixed dementia. 9. Normal pressure hydrocephalus. 10. Posterior cortical atrophy. 11. Parkinson's disease dementia. 12. Traumatic brain injury. 13. Vascular dementia. 14. Korsakoff Syndrome. What is Alzheimer's? Alzheimer's is a progressive brain disease that causes problems with memory, reasoning, behavior, and motor skills. Symptoms of Alzheimer's slowly worsen over time, and the disease is ultimately fatal. Alzheimer's is the most common form of dementia, which is defined as a loss of cognitive functioning and behavioral abilities that interferes with daily life. Other forms of dementia include vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. Each of these diseases has its own set of specific symptoms. Risk for Alzheimer's increases greatly with age. After reaching 65, one's risk of developing Alzheimer's doubles. Roughly every 5 years, reaching almost 50% by age 85. When the disease begins before the age of 65, it is known as early onset or younger onset Alzheimer's. Right now, Alzheimer's disease has no known cure. Current medications only help to lessen symptoms of the disease, providing temporary and partial relief but having no real effect on cognitive decline. In addition to the emotional burden placed on patients and caregivers, Alzheimer's places enormous financial strain on families and healthcare systems. Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. Alzheimer's disease accounts for 60 to 80% of cases. Vascular dementia, which occurs after a stroke, is the second most common dementia type. But there are many other conditions that can cause symptoms of dementia, including some that are reversible, such as thyroid problems and vitamin deficiencies. Dementia is often incorrectly referred to as senility or senile dementia, which reflects the formerly widespread but incorrect belief that serious mental decline is a normal part of aging. Common types of dementia. What is Alzheimer's? Memory loss and other symptoms of dementia. Many people have memory loss issues. This does not mean they have Alzheimer's or another dementia. There are many different causes of memory problems. If you or a loved one is experiencing troubling symptoms, visit a doctor to learn the reason. Some causes of dementia-like symptoms can be reversed. Visiting your doctor. While symptoms of dementia can vary greatly, at least 2 of the following core mental functions must be significantly impaired to be considered dementia. Memory is communication and language, ability to focus and pay attention, reasoning and judgment, visual perception. People with dementia may have problems with short-term memory, keeping track of a purse or wallet, paying bills, planning and preparing meals, remembering appointments or traveling out of the neighborhood. Many dementias are progressive, meaning symptoms start out slowly and gradually get worse. If you or a loved one is experiencing memory difficulties or other changes in thinking skills, don't ignore them. See a doctor soon to determine the cause. Professional evaluation may detect a treatable condition. And even if symptoms suggest dementia, early diagnosis allows a person to get the maximum benefit from available treatments and provides an opportunity to volunteer for clinical trials or studies. It also provides time to plan for the future. 10 warning signs, stages of Alzheimer's. Causes of dementia. Dementia is caused by damage to brain cells. This damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot communicate normally, thinking, behavior, and feelings can be affected. The brain has many distinct regions, each of which is responsible for different functions, for example, memory, judgment, and movement. When cells in a particular region are damaged, that region cannot carry out its functions normally. Different types of dementia are associated with particular types of brain cell damage in particular regions of the brain. For example, in Alzheimer's disease, high levels of certain proteins inside and outside brain cells make it hard for brain cells to stay healthy and to communicate with each other. The brain region called the hippocampus is the center of learning and memory in the brain, and the brain cells in this region are often the first to be damaged. That's why memory loss is often one of the earliest symptoms of Alzheimer's. While most changes in the brain that cause dementia are permanent and worsen over time, thinking and memory problems caused by the following conditions may improve when the condition is treated or addressed. Depression, medication side effects, excess use of alcohol, thyroid problems, vitamin deficiencies. Back to top. Diagnosis of dementia. There is no one test to determine if someone has dementia. Doctors diagnose Alzheimer's and other types of dementia based on a careful medical history, a physical examination, laboratory tests, and the characteristic changes in thinking, day-to-day function and behavior associated with each type. Doctors can determine that a person has dementia with a high level of certainty. But it's harder to determine the exact type of dementia because the symptoms and brain changes of different dementias can overlap. In some cases, the doctor may diagnose dementia and not specify a type. If this occurs, it may be necessary to see a specialist such as a neurologist or geropsychologist. Dementia treatment and care. Treatment of dementia depends on its cause. In the case of most progressive dementias, including Alzheimer's disease, there is no cure and no treatment that slows or stops its progression. But there are drug treatments that may temporarily improve symptoms. The same medications used to treat Alzheimer's are among the drugs sometimes prescribed to help with symptoms of other types of dementias. Non-drug therapies can also alleviate some symptoms of dementia. Ultimately, the path to effective new treatments for dementia is through increased research funding and increased participation in clinical studies. Right now, volunteers are urgently needed to participate in more than 180 plus actively enrolling clinical studies and trials about Alzheimer's and related dementias. Medications for memory loss, alternative treatments for Alzheimer's. Dementia risk and prevention. Some risk factors for dementia, such as age and genetics, cannot be changed. But researchers continue to explore the impact of other risk factors on brain health and prevention of dementia. Some of the most active areas of research in risk reduction and prevention include cardiovascular factors, physical fitness, and diet. Cardiovascular risk factors. Your brain is nourished by one of your body's richest networks of blood vessels. Anything that damages blood vessels anywhere in your body can damage blood vessels in your brain, depriving brain cells of vital food and oxygen. Blood vessel changes in the brain are linked to vascular dementia. They often are present along with changes caused by other types of dementia, including Alzheimer's disease and dementia with Lewy bodies. These changes may interact to cause faster decline or make impairments more severe. You can help protect your brain with some of the same strategies that protect your heart. Don't smoke. Take steps to keep your blood pressure, cholesterol and blood sugar within recommended limits, and maintain a healthy weight. Physical exercise. Regular physical exercise may help lower the risk of some types of dementia. Evidence suggests exercise may directly benefit brain cells by increasing blood and oxygen flow to the brain. Diet. What you eat may have its greatest impact on brain health through its effect on heart health. The best current evidence suggests that heart-healthy eating patterns, such as the Mediterranean diet, also may help protect the brain. A Mediterranean diet includes relatively little red meat and emphasizes whole grains, fruits and vegetables, fish and shellfish, and nuts, olive oil and other healthy fats. If you like this video, give it a thumb up and do subscribe my channel. Thank you.